Good morning. This is Dr. David Kemp. I am a board-certified functional neurologist here to talk about Parkinson's. Okay? Now, many people have heard Parkinson's, right? Many people have it. But we're understanding more about Parkinson's, and we're understanding that it can be diagnosed at a much earlier stage. Okay? Now, what happens first, you get these proteins that lay down in the gut, right? They're called alpha-synucleinopathies. Right, they get these Lewy bodies, which are these proteins. They get walled off in Myers and Arbuck's plexus, these little nerve plexuses in your gut. So the first symptom that we see in Parkinson's is constipation. It's usually young, like in their teens. Okay. Now these proteins will start to migrate up into the olfactory bulbs, which sit kind of just under your frontal lobe and on top of this little cribriform plate. All right, and that's what you use to smell. So they'll lose their ability to smell, identify smells. Right, now these proteins will start to migrate down into their nigra, and that's when they start to get these tremors. Okay, and that's when we start to see the pill rolling tremor, and that's when they're diagnosed with Parkinson's. Or they might have 30 years of constipation before that comes. So you want to get to that first, okay, because then you can slow the progression of this disease. Now, as it progresses, it gets into the areas of their brain that have maps of their face. So you'll see a masked face, right, and they'll have inability to regulate their autonomic system, so their blood pressures will change up and down. Their bowels and bladder will change. They can't regulate them. And this is common when they get up, they'll be unsteady with their blood pressure changes. They also have a posterior center of pressure, which means like they're feeling like they're falling backwards. Or if you feel like you're falling backwards, they get this camptocornic posture where they'll stoop forward. Okay, and then they'll get a lot of forward head posture, and they'll get chronic lower back pain, and it's just a vicious cycle. Okay, now you'll also see in their gaits that they'll get decreased arm swing and decreased step, and they'll have freezing and hesitations. And these are things that are regulated by the brain, and they're having difficulty doing multiple tasks at once. Many of our Parkinson's patients have micrographia, where they write really small. Now here's the deal, they know they're writing small, and they're trying to tell their hand to write bigger, but they can't because they can't dual task very well, so they can't think and do something at the same time. So they know that they're writing small, they just can't fix it, and it's sad. So we want to do our best to try and help these patients. Now we do that, one, with finding what part of the brain is still intact, okay, and utilizing the part that's intact and wiring around the plaquing. So even though you have the plaquing in the brain, these little proteins lie down, we can still work around it, okay. So what I want you to do is just understand that Parkinson's is a progressive disorder, and if you catch it early enough, you can slow the progression. Now, maybe reverse it, I don't know, okay? But I'm seeing success in our field with Parkinson's, okay? And medication doesn't really help these conditions. It helps the slowness, but it doesn't help their posture, and it doesn't help their balance, because what we've noticed is the more L-DOPA you give them to help their tremor, the more balance problems they have. Now, as you age, the number one cause of death is falling, so if it's going to make your balance worse, chances are that you're going to get to a quicker demise up in your L-DOPA levels. Okay, so what we want to do is work with your medical doctor in titrating the L-DOPA as needed so that you don't have an early fall and a quick demise. Okay, so I hope this helped you with your Parkinson's cases. Make sure if anyone in your family has it, that you get to a functional neurologist and look at another option of care.